to a world with COVID-19 resilience. So today this is a very important panel because we are living in COVID-19 and we really need to build the resilience. The fact that this Congress held, with the pandemic is still raging, and we managed to hold this hybrid to unite all the medical women from all over the world for this Congress shows our resilience. So to begin, I would like to invite every one of us to give us a round of applause. So let's start the session. Katie?
Thank you. Can everybody hear me? Yes. Thank you. Thank you so much. Shake. First of all, I think okay. Hi everyone, can you hear me now? Thank you. So technology works. Thank you. So good morning, good evening, good night, good afternoon to everybody. And first of all, thank you so much from the bottom of my heart to the LOC and to all the distinguished guests for making sure we have this panel. And it is an honor and a privilege for us and my colleagues sitting here to come back here to Taiwan in this time. And we are so happy because it shows the spirit of humanity. COVID has not destroyed the spirit of friendship or humanity. So thank you so much. And I would like to give a big shout out to Dr. Lai and Susan Gao, Susan and Sherry, the Superb S&S. So I give you a new name today, Superb Sherry and Superb Susan. Professor. And Your Excellency, Dr. Chen, it is such an honor and a privilege because even before I had the pleasure of meeting you a few years ago, the work you have done is amazing. You are a true global health diplomat, sir. I salute you. Thank you so much. It's really amazing and very humbling to be here in your presence and for this important panel. And I would not be doing my duty if I did not thank Ruby. She's really a jewel because you worked so hard, Ruby, Dr. Chen, to put this whole panel together. Thank you so much. So ladies and gentlemen, today we have a really interesting panel discussion and it gives me great pleasure. And we have 3 men on the panel and we also have Ruby and me, who are the 2 ladies, to add color to the panel. And I would like to very briefly introduce His Excellency, Professor Chen Chia-jen, who is a very well-known epidemiologist, and he got his training in Johns Hopkins in the United States. And he was an associate professor and professor in National Taiwan University, as we know, which has an excellent research record. His full bio is here in the book, but I just want to mention one thing about him, that Dr. Chen is so low-key, and he has received the Knight of the Equestrian Order of the Holy Sepulchre and the Pontification Equestrian Order of the St. Gregory the Great in Vatican. So he has been recognized not only by the scientific community, but also by the other communities. And also the Knowledge of the World Award of Johns Hopkins as a very distinguished alumni. So sir, I could go on, but my apologies because I just had to pick the best parts of your bio, which was not easy, but his full bio, ladies and gentlemen, is in the book. So sir, over to you. You are our first speaker. Thank you so much.
Thank you very much, Professor Murphy. And it is really my pleasure and honor to be invited to give this talk, Successful COVID-19 Containment and Reform for Resilience, in this very important MWIA 2022 plenary section. And as we all know that COVID-19 has affected global health and sustainable development and social welfare in the world significantly. And the catastrophic pandemic originating from Wuhan, China, has caused at least 537 million confirmed cases and 6.3 million deaths by June 2022, with a significant GDP loss in almost all countries in 2020. And as we all know that, we can divide this epidemic containment into three phases. The first phase is the interruption of viral transmission through non-pharmaceutical interventions. And the aim of the phase one intervention is the zero COVID, through the border control, mandatory reporting and testing of suspected cases, hospitalization and isolation treatment of confirmed cases, as well as the hospital infection control and home or hotel quarantine of inbound passengers from epidemic areas, and also the close contact tracing, testing, and isolation. And wearing face masks, washing hands, social distancing, and avoidance of gathering are also very important. And in some countries, they even close the school or the workplace, and some countries even have the city shutdown and so forth. And in the second phase of the pandemic containment, is the increase of population immunity through the vaccination. The aim of the phase 2 intervention is the rapid increase of vaccination coverage. But when Omicron came, it spread so widely and so quickly. So the phase 3 is the prevention of COVID-19 deaths and long-term sequelae using rapid diagnostic and antiviral. And the aim of the intervention became the live with the virus. And in Taiwan, we are aware of the atypical pneumonia cases in Wuhan quite early on December 31st, 2019. And when we learned this information from the social media, we immediately informed the World Health Organization and China CDC. And on the same day, December 31st of 2019, we started the onboard quarantine of passengers from Wuhan. And on the January 7th, when World Health Organization announced the causal agent of COVID-19, we in Taiwan, our Taiwan CDC announced the travel alert for Wuhan. And the first case in Taiwan came on the January 21st from the Wuhan, and on the January 22nd, our President Dr. Tsai Ing-wen called for an emergency meeting of National Security Council, and we activate our interministerial Central Epidemic Command Center. And until January 31st, WHO announced the COVID-19 as a PHEIC, Public Health Emergency of International Concern. So Taiwan took action much earlier than our World Health Organization and most countries. And as you can see here, on the January 22nd, when we have the National Security Council meeting, President Dr. Tsai Ing-wen announced that we have to set up this Taiwan model, including the prudent action, rapid response, early deployment, transparency, public trust, and social solidarity. And so in the first one, non-pharmaceutical intervention, we use a lot of smart technology to help us do this border control and contact tracing and so forth. There was no city lockdown and no mass testing in Taiwan. However, we have a very prudent surveillance of pandemic status using the ICT and AI technology. And we also have rapid announcement of travel warning using the self-broadcast. When there's a Diamond Princess cruise come to Taiwan, we announce this rapid announcement to 0.6 million people within 1 day. And the stringent border control using the e-quarantine system is very important for us. All the passengers came to Taiwan has to be home quarantined or in the hotel for 14 days. And we use e-quarantine system to monitor this, all the quarantined people. And we have intensive and comprehensive contact tracing and testing using the ICT information and big data analysis. And when there was a close contact, then we had to use that mandatory home isolation or quarantine. We use digital fencing system and landmark system to provide care services to all the quarantined and isolated people. And the precision test of the reported suspect with this traveling, occupation, clustering, and contact history, and they have to be tested. And also, we enhance the isolation treatment and hospital infection control using this big data monitoring. And in Taiwan, we try our best to assure that all these people in Taiwan can have a good access of the information. So daily press briefing to announce transparent information, health education, and risk communication, and to resist disinformation attack, especially from our neighboring countries. And we also our best to have adequate supply of PPE and other medical material through mass production, land-based e-rationing, and we enforced the non-pharmaceutical intervention using online education and self-broadcast. We also use the e-allocation to provide financial relief and economic stimulus. So we also try our best to develop and procure of rapid diagnostic antiviral and vaccines. And we also engaged in international collaboration. I would like to give you one example. At the very beginning of this 2020, we run short of face masks. Every day we have only the production of 1.8 million in January. However, we requisition of 73 factories to expand 92 production lines. So in May 2020, we already have a production of 21 million face masks in a day. And we also have this kind of system to have a name-based distribution system to allow everyone in Taiwan, no matter they are rich or poor, they can have very good access of the face mask. And we even have the face mask to have to allow all the citizens to know which pharmacies they can purchase the face mask. When we have adequate face masks, we try our best to donate more than 50 million face masks to Europe, to UK, United States, and other 80 countries. We know that it is very important to help all these medical women or medical men in all countries to help them to prevent the infection. And in the pandemic containment, in addition to this epidemic containment, the financial support is also very important. So Dr. Tsai Ing-wen, our president, allocate this 840 billion NT dollars budget for epidemic control, financial relief, and economic vitality in 2020 to 2021. And we shift the public spending priority to emergency measures, and we also provide financial relief to the low-income family and damaged industry. We increase the government investment and procurement for the expansion of domestic demand. And this, we issue the economic stimulus voucher to spur domestic consumption. So in 2020, our GDP growth is 3.1, and in 2021, it's 6.3. According to the statistics of United States National Bureau of Economic Research, published in October of 2020, this figure compared 40 countries for the COVID days as well as economic growth. And as you can see, Taiwan is a marginal country